Welcome back, everybody. It's Leah with Skin Beautiful RX. I am so excited because today we have Dr. Charlie Chen with us, who is a plastic and reconstructive surgeon out of San Diego, California. Dr. Chen, why don't you tell us a little bit about yourself?
Sure, yeah. So thanks for having me, first of all, Dr. Charlie Chen. I'm very excited to be on the show here with Leah. So yeah, I am a plastic surgeon. Previously, I was practicing in the New York City area. I've since kind of migrated all the way across the country, and now in the San Diego region, have my own practice in this area. However, with that said, I still kind of cover a lot of ground bi-coastally. I focus mainly on cosmetic surgery. I do both surgical procedures for improvement aesthetics as well as non-surgical procedures, fillers, lasers, and such. So very open about all the treatments that are out there, and be more than happy to share what I have with all your audience.
Great. Yeah, I get a lot of questions daily about, plastic surgery, Botox, and lasers. And while I can kind of talk factually about it, obviously I'm not a doctor, so I can't give medical advice. So I was just so thrilled that you were willing to come on and answer our viewers' questions. So great. Let's just get started. So the new Botox, I don't even know how to say it exactly. You probably do, so I'm gonna let you say it. How do you say it, one, and what do you think of it?
Yes, so Juvo is the name of the new Botox essentially that's out. And people call it new tox. There's multiple nicknames that are for it. But what it comes down to is it's actually a very similar product to the Botox that's already on the market. It's made out of very similar toxins, so to speak. And it does very similar events. So what it does is that it relaxes the muscles, and is concentrated on areas in your forehead or frown lines and what it does is, again, it relaxes your muscles. So I know some of the questions that I get asked often are, what are the differences? Is it better than Botox? Is it any different with onset and everything like that? What I would say is, in my experience, as well as others that other plastic surgeons that administer it, is that the effects are very similar. So what that means is that the onset usually is about 2 or 3 days after the injections, and longevity can last anywhere from 4 to 6 months, depending on how often you've had the treatments already in the past. So again, it's very similar to Botox itself. Honestly, I don't think it's any better or any worse than Botox or new tox. So I would say, obviously, Botox has been on the market for the longest period of time. People are comfortable with it. They've become it's a very known brand. So that's still obviously the most popular neurotoxin that we inject. With that said, though, Dysport has also been on the market for a while. We do inject that as well, and certainly now there's a surge of demand for this Juvo product. So coming on strong as well. So
actually, leading into that, the next question. A lot of people say, when they go, every time they get Dysport or Botox, they have a different outcome when it comes to who's injecting them. And with the brow lift, is there a certain spot? Because I can even attest to that. Sometimes they do it here, sometimes it's up here. The majority of the time, it actually drops my brows. So, is there an actual technique, or is it just kind of like one time you get lucky, one time you don't?
No, so yeah, that's actually a really good question, because that's one of the most popular areas that I always get asked about, doing the Botox for brow lift area. So what you're actually trying to target with the brow lift is actually a very thin muscle called orbicularis oculus, orbicularis oculus, and that's around your eyes. And because it's such a thin muscle, sometimes if you are unsure of the anatomy, it may be a little harder to target. So what it is that that's the muscle that actually causes you to pull your forehead and your brow down. It's actually what causes your eyes to squint, essentially. When you relax just the lateral upper portion of that muscle, if you relax that, that causes your lateral brow to actually lift up higher, because the muscles around the sides here, if you keep it active, it'll actually pull upwards when the downward forces are relaxed. as long as you relax that lateral portion of that muscle, you're able to cause the brow to lift because the forehead muscles are still working to pull that up. With that said, if you actually relax, if you're doing Botox at the same time and you're relaxing those forehead muscles, that can drop the brow, on the sides. So sometimes it's a matter of, being able to kind of pinpoint that specific thin muscle around the eyes. And like I said, it's usually right around where the brow line is, a little below that, in order to cause that lifting effect.
Oh, that's great. So, and also just getting an injector then that really knows the anatomy is going to be really important when it comes to the brow lift.
Well, yeah, definitely.
Next question is treatments for rosacea. If somebody's tried every product over the counter, is there a laser, any type of treatment that you would suggest that you've seen good outcomes with?
Yeah. So rosacea is one of those very common skin problems. I think the most important thing is actually number one to differentiate it from other medical disorders that may be mimicking the process. So, seborrheic dermatitis is something. It's also an inflammation around your around the nose, around the cheeks area, and that's actually caused by a fungal infection. So if you're only doing skincare and you're not really, treating the underlying disorder, then you may not, be treating the right thing. So that said, if it's, purely rosacea, which is basically an inflammation of the vessels around your skin, around the cheeks region and around your nose region, if it's purely that, then there are skin products as well as lasers. So one thing is, IPLs. Treatment. So that's one thing where the laser can actually target the vessels, cause it to constrict, and take away the vessels that cause that redness feature. So that's one aspect. Another aspect certainly is making sure that you know what some people have triggers for. So spicy food or a certain season kind of cause it to worsen. Exactly. So yeah, everyone it kind of knows what their triggers are. Obviously, trying to minimize that trigger can also help, with it.
So the next question is, what is your opinion on PRP injections for skin tightening, or is there a laser that you would recommend for the laxity of the skin?
Right. So PRP is one of those hot fields right now where I think there's certainly a lot of potential. So what PRP stands for is platelet-rich plasma. Basically, what happens is that you spin they draw your blood, you spin it down. What you do with that is that you obtain that portion and you can apply it to different areas in the body. Some people inject it. There's some research that is being done into hair restoration with injections. But certainly, the big, what I guess, popularized it was, Kim Kardashian doing the vampire facial. So,
I love that episode.
Yeah, so you call it vampire facial, basically because you are drawing blood out and you're reapplying into the face after, microneedling and things like that. But what it does is that, it kind of sends the signals to your body to create new collagen. So the basis behind kind of at least the theory behind it is that you want to bring new collagen into your skin to create more hydration, everything like that, to rejuvenate the skin. So that's kind of the concept behind PRP treatments in general. I wouldn't say though that it's realistically that by itself is a good treatment for tightening the skin. So I usually tell people that PRPs are good as an adjuvant therapy, something on top of what you're already doing. But certainly to tighten the skin by itself is probably not a good modality for that. For that, tightening the skin, there's certainly a whole spectrum of what you can do to tighten up. And that ranges from everything from, let's say, a chemical peel where you're refreshing the skin, again, generating new collagen through after the peel to tighten some of the skin layers, or kind of to again, laser treatment. So again, the whole spectrum. Realistically, it kind of depends on the amount of skin laxity that you already have.
Yeah, I get asked a lot when people go in for like microneedling if I think PRP is worth it, and I always say no. But what do you think? here in Ohio, it's like an add-on of between like $400 and $600, and I've seen it help with like reducing the redness or like healing quicker. But I don't know if it's like worth that. But maybe that's just
Right.
what I've seen. So, do you think it's really worth that price tag?
So I do think it is beneficial. With that
Mm-hmm.
said, though, there are different PRP machines to spin your blood down. So if someone who's purely just centrifuging it, yeah, they may not get the best effect. But there are certainly specific kits that are out there to try to get the most plasma, platelet-rich plasma out of the vial of blood that you draw out. So I think even just with that, there's kind of a different concentration of what product you're ultimately obtaining. So certainly, if you're getting high quality, PRP concentration, I do think that it can help in certain aspects. And kind of like I mentioned, there is a big science behind it now that's kind of driving this force. With that said, I think there are a lot of kind of variables how you're handling the product, and that certainly contributes to some of the variable results that you're seeing out there. To purely that product to say, okay, I'm going to get a tight face tightening.
Realistic outcome, right?
Yeah, realistic about it, and if you're using it just as a supplement, I do think it does have promising results. So.
Okay, great. Maybe I'll change my mind on it. Okay, the next question is what can be done about chicken skin? And I'm assuming that's like the texture underneath the eyes. I don't know if that's more like just texture, milia, but is there something that fixes that?
Yeah, so I do think there are two components of the lower lid skin. So if there's hollowing of the skin of that infraorbital region here, that can certainly cause the skin to kind of bunch up against each other and cause a little bit more darkening, maybe some of the irregularities that maybe people may call a chicken skin. If that's the case, you may want to add volume into it, whether that's done through a filler, Juvederm Restylane, or fats that you put inside that area. But there's also that other component where it's the skin texture portion. So if it's related to the skin, some people just have a little bit of darkening of the skin, the lower eyelids, then you do need some skin products to essentially rejuvenate that. And again,
What I recommend typically is a growth factor and like a really gentle vitamin A. Then after that, I'm assuming, yeah, it's probably onto the filler option. The best procedure for eliminating visible capillaries, and the few people that actually ask me this question I know pretty well, and they also have rosacea. So regular capillaries, and then somebody with rosacea prone skin with those broken capillaries, what's the best in-office treatment?
back to our original conversation about the rosacea, these are specifically targeted. And you can actually see it during your treatment. Is that once you apply the IPL, you can see kind of the darkening of the vessels, and basically that's the vessels being kind of burned and kind of constricting. So you can see those vessels actually being treated, and that's at least as a practitioner, that's pretty satisfactory. Being able to see that what you're treating. And the effects are, pretty, immediate. You may have some redness that's triggered by the IPL treatment, but afterwards, that does get rid of a lot of those capillaries. Now, some people do require several treatments in order to kind of achieve the results, and they may need to come back at a certain point to get that retreated. But like I said, it's pretty quick procedure. Most people would describe it as kind of rubber band kind of flick, during treatment, but it's very effective targeting those capillaries.
Yeah. Yeah, pain is completely different when it's in the name of beauty, right?
Right.
What surgical face procedure do you do the most? And short of a full facelift, what procedure is recommended for like a rejuvenated look or like mimicking a facelift without actually having to get one or pay for one?
So excellent questions. Yeah. So the most minimally invasive way of kind of creating that facelift effect certainly is through fillers. That's one way of essentially revolumizing some of the fat that you lose over time with age and such. And it's realistically not just the fat portion that gets lost over time, but it's also the bone structure that kind of loses volume over time. So in order to achieve that more youthful look, you want to restore volume into your cheeks to recreate that triangle of youth, as we call it. So that's one way of achieving more volume, to create a more lifting effect. And the more kind of powerful tool that we have for kind of more moderate to severe facial aging is through obviously a facelift. There's different people that describe it as different techniques. Some people say there's mini facelifts or full facelifts, a neck lift portion. But realistically, what it comes down to is that you make an opening through around the ear here. And usually, really these days, most people are moving away from that artificially pulled look. And so most people are actually pulling, or at least treating the deeper layer, which is called a SMAS layer. That's actually your strength layer of your skin. So longevity with regards to how long your results can last for. And that also avoids that artificially pulled look if you're just using the skin to pull everything back. So like I said, there's different kind of modalities, and it can range again from fillers to the facelift, which is.
How do you feel about threading? Do you think that's anything?
So that's also a very popular topic. So threading is basically putting absorbable, essentially absorbable sutures to pull your face back. What I would say about it is because the threads are absorbable, the results usually are pretty temporary. So you get that long-lasting effect with threading. You may look good kind of right in the office, and even a little bit afterwards with that, and the effects of it don't last long. So it's a tool if people don't want to do surgery or don't want to do any kind of other treatments, and it's pretty minimally invasive, like I would say. But
I feel like that was a really quick fad, at least here. It kind of came in, was like the talk of the town, and then left really quickly. So it may be an attest to the longevity of the results. So. And what do you recommend skincare routine or ingredients to keep melasma, freckles, sunspots away?
Okay. So melasma, just in general, is just hyperpigmentation of the skin, and it can be triggered, by sometimes, hormonal changes after pregnancy. Things that can certainly trigger melasma. It's one of those things that you have to, number one, obviously have a good, skincare routine, but also you want to target the pigments of the skin. So anything certainly with hydroquinone are good at lightening the skin. They have, kits that are specifically made for melasma or pigment control, and they're very effective. Like I said, most of the products itself have some kind of either hydroquinone and such to lighten up the skin and to treat the melasma itself. For warmer climates, more humid regions, I think have a more kind of difficult time with some of the skin control issues.
Is there any way, and I hear this all the time too, is there any way to Botox last longer?
That's a great question. So we'll start with Botox. So Botox, realistically, there's not a lot of kind of a sure way method of elongating the effects of it. There are some studies that say if you perhaps mix it with lidocaine with epinephrine, maybe it may last a little bit longer, but realistically that's not something that the manufacturer recommends. They recommend just mixing it with normal saline, kind of the safest way for it to to constitute the product and to get it into your skin. How powerful some of your muscles are. Certainly the dosage can you want to make sure they have the right dosage for the right patient. So in males and someone who already has lines that are there even without any facial expression, you want to make sure you obviously treat it with a higher dose. So obviously if underdosing, you're not going to get the desired effects. With that said, some people do say that and it makes sense, the more treatments you've had, the more that the muscle relaxes over time or kind of atrophies away over time. So it does potentially last longer if that muscle isn't as powerful. So someone who starting Botox treatment in their early 20s, by the time they're 30s or 40s, their effects are probably going to last longer just because that muscle isn't as powerful anymore. So certainly over time, that can be a factor.
So the next question is twofold. One, if you do get Kybella, are you left with a bunch of sagging skin? Because I don't think Kybella actually says that they are also, there's any retraction with it, but is there actually retraction, or are you just kind of left with all this extra skin?
Kybella, so just a little background, Kybella is the first FDA-approved product specifically to treat the fat cells along the submental or the chin region here. But it's similar to any kind of treatment for specifically targeting the fat. So even let's say liposuction, if you're liposuctioning the chin, you take away the fat cells, the skin to a certain extent will retract back just by itself. Your body's natural tendency, if it has an empty space, is to, especially with over time, is that it contracts a little bit. How much contraction undergoes depends on your skin quality. So people who have more elastic skin, they're obviously going to have more retraction.
And is there an alternative to Kybella if needles in the neck scare you?
So no, so there's not another product out there that treats the fat layer through needle or non-invasive, minimally invasive means. Certainly, you have more invasive tools like kind of like I mentioned earlier, the liposuction that can target the fat, but not currently. There's no other product that are similar to Kybella. So it's one of its kind right now.
Awesome. Now, how do you feel about CoolSculpting in that area?
Yeah. So CoolSculpting is one of the other tools that can target. So it's a complete different modality in that it essentially kind of freezes the fat and allows your body to reabsorb the fat afterwards. So it doesn't even require any any needling or anything like that. Now, the only thing I also tell people about CoolSculpting is that it works to a certain extent. So someone, let's say, has excess fat, let's say on a scale of 1 to 10, it may be able to take away, 20, 30, 40%, but it won't take away the whole volume of fat.
I think you're right. I think it's per treatment area, and like the modality for the neck's obviously like tiny. So 20%, I think, of that tiny little area, and that's not really that much. The Sculptra in the temples, a good long-term solution to lifting the face over traditional filler, and will it make the eyes seem closer together?
Sculptra is in a kind of completely different family from what you would normally say for Restylane and for Juvederm. So a lot of the Juvederm and Restylane, those fall into the family of what's called hyaluronic acid. Sculptra is different, and it's a completely different product. That said, though, it's indicated for it's actually being advertised and approved for more longer lasting effects. So some people say that it lasts all the way up to about 2 years. With that said, though, so Sculptra can be used to fill volume in the face, and including kind of the temple areas. The only thing that I typically warn people about Sculptra is that it's not reversible. So obviously the danger areas when you're injecting is making sure you're not injecting into any of the blood vessels, because that can certainly clog up some of the blood flow to your face. With the hyaluronic acid, like Restylane and Juvederm, you can actually use a product what's called hyaluronidase. If you do ever run into trouble, use that to reverse the effects of the hyaluronic acid. Sculptra doesn't really have that reversible agent, so I typically kind of warn people a little bit about using Sculptra. It does have its indications. A lot of people use Sculptra, and like I said, it's a more longer lasting product for people out there. But that's one of the pros and cons that everyone has to kind of weigh in. With regards to to the kind of changing the the aperture of the eyes and such, typically that doesn't really change it. The shape of your eyes typically is kind of formed by the bony structure. When you're injecting, especially the temples area, you're going, kind of away from that bony structure, and you're not really able to move the bony structure. So typically, unless you're, which it isn't indicated for, you shouldn't be injecting around the eyes anyways. But if it's purely the temples, then it shouldn't change any of your eye structures. Yeah.
Okay, great. Well, speaking to non-reversible, what are your thoughts on radiesse and radiesse in the temples?
Yeah, so along the same line, so I, I've used all those products, but I always tell people, as part of the, they're being informed, is that those are non-reversible products.
The best treatment for marionette lines.
Yes. So the marionette lines are basically lines that extend from the corner of your mouth down to the edge of your jaw here. It kind of goes along the same lines as your nasolabial lines, or at least the cause of it are similar in that you have a ligament that actually holds everything in place, but when your skin and fat kind of atrophies over time, it kind of has a downward gravitating force that pulls it down, and it creates more of a lump, I guess, so to speak, over what these lines are. So the treatment for it is, number one, if you have kind of a mild marionette line, you can fill it in with filler. Those are very effective in masking or filling in those areas where you have indentation. Certainly, if it's more severe, then the facelift would actually address it as well.
It's too young to get a facelift, or to address that. Like, what is like a no? You need to go home, get out of my office age. And
That's a very good question. We've, this is just, plastic surgeons in general. We've had patients, as young as, in their early 30s that come in for a facelift, all the way down to people who are 80s and 90s. So there's not really a, age cutoff or anything like that. Certainly, some people have a medical indication for having that skin that's extra that needs to be pulled back. But otherwise, I don't think, from a cosmetic standpoint, there's really no age restriction. As long as you have that problem, there's a tool to try to address that or improve it. So, yeah.
Good to know. Non-surgical improvements for hooded eyelids. Does one exist?
So hooded eyelids is one of those things where, essentially you have extra skin along your eye. So in order to get rid of the extra skin, realistically, it's a surgical procedure. Upper blepharoplasty, basically removing the extra skin. There's not a lot of kind of, non-surgical treatments. There's not, you can't put a filler in that area. You can't put a Botox in that area to really address it. Like we talked about, you may, do some Botox around the brows to kind of lift everything up. That may help a little bit, but realistically, if it's a noticeable hooding, usually, any of the non-invasive stuff probably wouldn't work much on it. So, like I said, the best thing is really to, surgically remove it.
I've actually had a lot of friends who've had upper blefs. So when I think it's a kind of easy, not easy for you, but easy for like the actual patient. Some doctors will actually do it with just local, an in-office, and then, how quickly can you go back to work? Because I think a lot of people want that done, but they don't realize that it's not as like extensive on the patient as, a tummy tuck, something else like that.
Yeah, so, blepharoplasty is kind of in the spectrum of kind of how big the surgeries are. It's actually on the lower half of things. What that means is that many surgeons do it under just local anesthesia. Basically, kind of like going to your dentist where they inject the numbing medication, but instead it numb the skin right above your upper eyelid. And once you numb that area up, it's usually a pretty comfortable procedure. You really don't feel anything in that area. And what it involves is that it takes out, before the surgery, you'll mark it out with your surgeon to see what areas are in excess. So you'll mark the areas that are in excess, and you remove that. Some people have some fullness in the upper eyelid from the fat, and if that's the case, some of the fat that's underneath your eyelid also gets taken out. But usually that's all kind of, like I said, pretty, comfortable procedure. And I would say, a normal, straightforward upper-plasty probably takes probably around 30 minutes or so. So it's not a long procedure. And like I said, after you take out the skin, the fat, realistically is just closing up the skin to approximate, bridging the two skin layers together. There is some swelling. Usually it's about, the most severe is probably the first few days. But then, with ice packs, things like that, a lot of that swelling goes away pretty quickly. Most people, return back to work and such within a week. And realistically, it's the only reason why they may not go to work is, related to some of the swelling, not because of, that they can't see or because they can't tolerate the pain or anything like that. It's just, more for, cosmesis and social reasons. So if you only think about it, it's probably only about, 7 or 8 centimeters total length of how much of skin that you take out in total. So it's a pretty small, little area on each side. Obviously, it's important because it's around your eyes, but the effects can be pretty dramatic.
Oh, yeah.
That's something that we always look at, talking to other people or looking in their eyes and everything. So it's a very kind of readily available improvement, so to speak. Yeah.
Yeah, I totally agree. Next question is, are non-invasive body contouring treatments worth it? And is there like a certain weight range where the best option is going to be lipo?
Yeah, so that's a good question. So CoolSculpting is probably what the question is coming from. Basically, kind of like what we were talking a little bit beforehand. If you're realistic about the amount of fat that it can take that you want to get rid of, that may be a good candidate for it. Now, it's actually, it's because it's not a surgery. It probably is, safer to perform. And so there's not, typically sometimes if someone's undergoing surgery, they probably would require a medical clearance, or if they're too obese, they may not be candidates for undergoing liposuction. Because CoolSculpting isn't a surgery, there really isn't a cutoff of what your weight is, or what are the good candidates for CoolSculpting. So the range of I guess the population that you can undergo population is a little bit wider. With that said, kind of like I said before, if you're someone who does have significant additional fat, CoolSculpting may not be a good choice because it's really a contouring procedure to get rid of some of the mild excess fat. One of the other points I did want to make, obviously, I think important for people is obviously financial reasons. So, CoolSculpting is still, per treatment, it's a couple of $1,000s probably. So if you're having to undergo 2 or maybe 3 treatments of CoolSculpting, that may equate to undergoing your liposuction procedure. So with liposuction being a more powerful tool, because we know we're going to get a good amount of fat out through liposuction, it may be worth just undergoing liposuction instead of, multiple times to CoolSculpting and trying to get that result. You may end up even, paying more as a result.
I've seen that happen actually. And I think a lot of people think that CoolSculpting is immediate. It actually takes about 3 months to really see those results, which I know with liposuction as well, you definitely have a time period. There's a bug flying around my face, sorry.
So liposuction, once you take out the fat, you can actually see the immediate results. With that said, you're going to have some swelling, and that's because a combination of things. Number one is, typically when we do liposuction, we put in what's called a medicine solution that helps with, pain control afterwards. It also minimizes the bleeding during surgery. It also just opens up the pocket. And so that fluid is pretty, opens that pocket to extract the fat. So that fluid is pretty important. And because of that fluid and also just your body's reaction to any surgery, you're going to have some swelling. So I typically tell people, a lot of that swelling, again, also goes away after 3 or 4 months. With that said, though, it usually is pretty immediate. You can kind of see the contours immediately after surgery, but that it continues to improve over time. Cool sculpting, because you're not immediately taking out that fat, you may not see that immediate result. So kind of like you said, it can take 3 or 4 months before some of that fat gets reabsorbed by the body. So it is a slower process, but both ways you're gonna, it does take some time before you say, okay, that's gonna be your final result.
Okay, so the next question is, what are ways, if you've already used skincare at home and you're not getting enough clearance with it regarding texture and texture irregularities, perioral or really just anywhere on the face?
Yes, so perioral lines are pretty stubborn, to say the least, a lot of times, and it's very common, especially someone who's had a lot of sun exposure, or some people who smoke. Those tend to be lines that can be pretty bothersome. So if they've already tried some of the basic skin care products and things like that, the next thing is to do a little bit more, something that's more aggressive, that takes the skin down a little deeper. So there's kind of two routes to take with that regard. So one is through a skin peel. So whether it's croton peel, things like that, where it takes out the outer, kind of the superficial skin. With a CO2 laser, in-office procedure, it's pretty quick, and if it's just within that area, usually can be done, in 20 minutes or so. Just expect, with both treatments, you can expect some redness afterwards, as you kind of heal from the peel process.
So when you are consulting with somebody who wants to undergo a facelift, do you require them to do pre-treatment and post-treatment with skincare products? And what's the thought process behind that? Does that help the patient? Does that help you? And what do you typically prescribe?
Yes, so perioperative skin regimen is actually very important, and I always put someone on a skin regimen beforehand, and that's because when you're doing surgery, you're kind of, like I mentioned earlier, you're actually treating some of the deeper underlying tissues. So that's mass layer pulling out, pulling it up, you're tightening the deeper aspect of the skin, and you may actually pull back the skin and everything like that, but you're not really treating the skin texture aspect. So I always put someone on a skincare regimen. There's various products that are out there. I can go back to the Zeo product that typically what I use. There's an anti-aging program that can be used just for your daily use. But typically, I like to start as early as possible, just because you're treating from both underneath as well as a superficial skin layer. So
Okay, great.
Continuing that even afterwards, to maintain the skin tone after.
So what is the bare minimum you recommend for an anti-aging at-home skincare regimen?
Yes, so there's several aspects to it. So you want to make sure that, first of all, you have a good cleanser. Obviously, you want to get rid of any of the dead skin cells or any kind of the dirt that's accumulated throughout the day. So a good cleanser. Number two, you want an exfoliant. So you want something that actually gets rid of some of the deeper layer skin cells that are on there. Then you want something that kind of hydrates. So a toner as well as a hydrating cream that basically rejuvenates, bring more fluid into the skin layer, and kind of make everything look a little bit more kind of more flush, more volume in that area. So I think that's the most important thing. As long as you have those steps there that you and obviously after, when you're outside, making sure also skincare, sunblock, that's also very important, because whenever you're outside, the UV rays coming in, that's all damaging this superficial skin layers. So that's also a very important aspect. So as long as you're hitting these different elements, you're kind of giving your skin the best chance to kind of survive the longest, or having the most kind of the qualities that you want for a healthy skin. So that's what I typically recommend.
Perfect. That actually leads into the next question. Do you really have to reapply your sunblock every 2 hours if you're outside?
Right. So they do recommend, with any kind of sunblock and SPF, it does obviously wear out. So they do recommend, putting it on every 2 or 3 hours. With that said, though, it's kind of like anything. They can make recommendations, but if it's physically not possible to do it, then it's not. So what I typically say is put it on as much as you can. But with that said, it's not realistic to be every watching your clock and saying, okay, it's time to. But it does wear off. Basically, that 2 hour frames that people talk about is when the effects kind of decrease by about 50% or so in certain sunblock.
So if you're like 5 minutes late, it's not going to be that big of a deal.
Not going to be that big of a deal.
Okay, I think we're on our last question. A way to make skincare products penetrate deeper.
Yeah, so anytime that you're creating kind of little openings or little pores, you're able to penetrate a little deeper. So that's why some people do microneedling of the skin to try to open up some of some of the outer skin elements in order for the products to penetrate deeper.
Are you an advocate of at-home derma rolling?
So at-home derma rolling, I think I think it's a very viable option. Now, one of the things that the concepts behind derma rolling or microneedling, things like that, are you want to get deep into the dermal kind of aspect of the skin. So some of the products that you can buy, let's say, over the counter or off the internet, it may be able to penetrate the outer the layer of the skin, but it may not be deep enough to really make much of a difference. So certainly if you go to an esthetician, things like that, they may be able to have products that go a little bit deeper and to actually create a difference. Because if you're just kind of rolling around the outside layer of skin, that probably won't make much of a difference.
Okay, great. Well, thank you so much, Dr. Chen. I'm so glad that you came on today. If you got anybody watching right now is in the San Diego area, I highly recommend you guys go see Dr. Chen for all of your aesthetic needs. He's absolutely fabulous, fantastic bedside manner, which is super important. And if you did not get to ask a question or you have one, please let us know. Drop them down in the comment box below. And hopefully we can have Dr. Chen on again in the near future to answer more fabulous questions.
Yeah, well, thanks for having me. I always appreciate sharing some of my knowledge, and feel free. Be happy to answer any questions anyone has. So.
Great, and I'll make sure to link your website down below too, in case anybody wants to get in contact with you.
Awesome.
Okay. Well, great. Well, thank you so much. I appreciate it.
Of course. Thanks for having me.